Hello, my name is Dr. Marjorie Gayanilo. I'm an assistant professor of pediatric cardiology at the Mount Sinai Kravis Children's Heart Center. I have a focus on not only general pediatric cardiology, but also non-invasive, which includes transthoracic and transesophageal echocardiography, fetal cardiology, as well as preventative cardiology. So I work in the echo lab at Mount Sinai Children's Hospital with the focus of just reading transthoracic, but also going into the operating room and doing transesophageal echoes to aid the surgeons. At Valley Hospital, I will have a focus on fetal cardiology, which basically is diagnosing structural heart disease in utero, as well as arrhythmias that may happen in fetal life. I will also be seeing pediatric patients in the cardiology clinic with a focus of following patients with congenital heart disease, but also assessing patients that may have symptoms of chest pain, syncope, palpitations, or heart murmurs. And also I have an interest in preventative cardiology, which is basically dyslipidemia of obesity, but also following patients with familial dyslipidemia and following patients with hypercholesterolemia related to metabolic syndromes like diabetes. So specifically, I take care of all patients with structural heart disease, from as simple as holes in the heart called VSDs or ASDs, but to complex lesions like single ventricle palliation, where patients have had to undergo multiple surgeries throughout their lifetime. And I basically take care of them until their young adult life, where then they're transitioned to the adult congenital heart disease program here. So after patients are diagnosed with fetal heart disease, they get referred to Mount Sinai. And at that time, we try to incorporate all the disciplines where the patient comes in, has a pediatric fetal echo done, meets the pediatric cardiologist. They also meet the social workers and the fetal heart coordinator. And if there is a structural heart disease that would require surgery soon after birth, we also have them meet with the cardiovascular surgeons at the same visit. That way, when they come into New York City, if they're coming from New Jersey or other parts of New York, they get to meet everyone on the same day. And we also try our best to coordinate with the MFM team, which is the maternal fetal medicine team. So when they transfer their care, they're basically coming in on the same day and meeting everyone, because it can be very cumbersome and stressful when you have a fetus that has heart disease and you have to meet everybody. We try to make it as simple as possible so that they can meet everyone and at least take that one step and make sure that everything is coordinated for their care. So what's great about Mount Sinai is that there's all subspecialists that are involved and easy access, because they have endocrinologists, neurodevelopmental specialists, gastroenterology, all the specialists that can be involved, because sometimes patients with complex congenital heart disease has other complex issues involving other organ systems. So it's easy access for the physicians, but also for the families. And that coordination of care is helpful because we can all meet on the same day. And the continued care can follow through until adulthood, because again, we have adult congenital heart disease program here. So the patients basically from in utero to adulthood can be followed in the same institution. So I think that physicians should refer to our location in New Jersey and New York City. But what's great about seeing me is that I have access to Mount Sinai and all the specialists that are involved, and I can bring it to New Jersey at Valley Hospital, because it's difficult in New Jersey. There's not cardiovascular surgical care. And so having patients in New Jersey having to travel to Mount Sinai in New York City can be very cumbersome. So I can be that bridge between New Jersey and New York City, where I can follow patients that's convenient to families, but have access to all the specialists in New York City. So physicians can make an appointment through the Mount Sinai website, where there's a number for the location in Mount Sinai and in New Jersey at Valley Hospital.